Good evening students, once again welcome back to our channel Ach'z. So today we had OET exam, the first date of this particular month, 5th April 2025. So in this video we are going to discuss about the available question papers from different centers for WLRS section. So let's start with our section. So coming towards the first module reading, in that the first set of question booklet, part A about atherosclerosis. In that the test A including definition, test B about the symptoms, how it affect the heart, digestive system, lungs, kidney, brain, etc. Then part C about the causes and stages, and part D about the complication and management. In that the C1 and C2 including PPE usage and holistic care. So coming towards the second set of question booklet, part A about asthma. In that the test A including definition of asthma and asthma attack, test B about the types, intermittent, persistent, like that, and test C about the causes like allergic and non-allergic, and it included symptoms. And the last test D about management and treatment. In that the C1 and C2 including equipment handling and also about the informed consent. Coming towards the third set of reading, in that part A about iron deficiency anemia. In that the test A including the overview and symptoms, test B about the causes like the blood loss, lack of iron in diet, inability to absorb the iron, pregnancy stages and all. Test C about risk factors and complication, and test D about prevention and care, how to choose the iron-rich diet and all. So that's about the three different set of question booklet under the first module reading. So if you got any other category or any other set of question means, try to mention that in the comment box, and do mention about your center or the country you appear your exam. Okay, now we will move on to the next module. So we just collected three different set of letter. All the letters were under referral letter only. So the first set of letter, a 35-year-old male with a history of alcohol dependency has agreed to seek a treatment after experiencing withdrawal symptoms and liver enzyme abnormalities. So your task is to write a referral letter to a rehabilitation center providing the details of his drinking history, withdrawal symptoms, and also the need for this structured detoxification and counseling. So that's about the first set of letter. Coming towards the second set of letter, the scenario is like 75-year-old patient exhibit memory loss and confusion. So you need to write a letter to the neurologist for the assessment of this possible dementia. So that's about the second set of letter. And the third set of letter, again referral letter only, and the scenario is 60-year-old patient recently experienced a myocardial infarction, and you need to compose a referral letter to the cardiac rehabilitation program to support recovery and about the lifestyle modification. So that's about the three different set of letters shared by students. Again, if you remember about the question booklet, means try to mention that in the comment box. Now we will move on to the next section. Moving further, listening section. In the first set of question booklet, a part A about the talk by a neurologist to the patient with ulcerative colitis, and B part including talk about new equipment training, and part C about the presentation based on elderly fall prevention. And coming towards the second set, part A including talk by a dermatologist about allergic reactions, part B including the workplace communication about monitoring devices, and C part including long talk based on managing workload. And coming towards the set 3, part A including talk by a GP about hepatitis, part B about interdisciplinary team communication, doctor-nurse collaboration, and part C about talk based on post-surgical rehab. So that's about the listening section. Now we will move on to the speaking role play cards. So the first set of role play card, the setting is emergency ward. Talk with the patient daughter. Patient suffer from cirrhosis of liver. He has been a drinker for a long time. Daughter is concerned about her father. So you want to restrain from the drinking habit. So you need to answer to the queries, educate about the father's condition, talk possible treatment modes, and provide suggestions to get over this alcohol addiction. So that's about the first role play card. Coming towards the second role play card, the setting is a woman health clinic. A 45-year-old woman worried about sleeping disturbances. So the whole body is experiencing fatigue, hot flashes, night sweat and all, and there is absence of menstruation for the past 3 months. So your task is to collect the information or all the details from the patient, and you need to educate about the menopausal phase and advise her to consult a gynecologist. So that's about the second role play card. So coming towards the third set of role play card, the setting is ortho ward and the patient is admitted with a fracture and worried about the condition and admission. So your task is to explain why he or she is admitted in the ward, and you need to reassure the patient, talk tactfully, and you need to advise the patient regarding different treatment options like the ORIF, like open reduction and internal fixation surgery to stabilize and to heal the broken bone. Then coming towards the next role play card, the setting is GP clinic, a 35-year-old planning to visit a tropical country. So your task is to advise on necessary vaccination, explain how to prevent the common travel illnesses, and provide general travel health tips. Then the fifth one, the setting is rehabilitation center, a 40-year-old recovering from a car accident. Your task is to explain the importance of physiotherapy, encourage the gradual movement, and you need to reassure about the progress. Coming towards the last role play card, the setting is community health center, a 40-year-old trying to quit smoking. So your task is to discuss the smoking risk, suggest the quitting strategies, and provide motivation and support. So that's about the role play cards students got today. So all the very best for your results, and I hope you all attended well. You can also comment your experiences in the chat box. So once again, thank you for your time over here, and if you want to get the updates on OET exams, the review section, the preparation guide, and nowadays we started to release the preparation guide for each and every date. So that will also help you out, or you will get a guideline how to you prepare for your test, what you can expect, what type of topic you need to concentrate and all. So try to cross check our playlist for more tips and tricks. Thank you so much for your time, and God bless you all.